Hi Blazers, we know that some of you have questions related to COVID-19, so we wanted to ask Dr. Michael Faircloth, the Medical Director of Student Health Services, a question related to your concerns. Hi Dr. Faircloth.
Hi, thank you for having me.
Thank you.
So, we're not masked, but we're socially distanced, and I'm vaccinated.
And I'm vaccinated as well.
And if you are someone who's not vaccinated, I would really highly encourage you to please get vaccinated.
There has been a lot of talk about COVID-19 mutations like the Delta variant. It sounds scary. So how does this happen and what does it mean for someone who is exposed?
So that's an excellent question. All viruses are constantly changing through the process of what we call mutation. And that's expected from viruses. Some of the mutations are good for that virus and those persist and go on in their progeny. And some are not, and if they're not and they don't have some advantage for that virus, they just die out. So when a virus infects you, it gets inside your cells and makes copies of itself. That's what it does. And when it makes copies, it copies the RNA, and that's called replication. And that helps the virus spread. So sometimes during that replicating process, there are random errors, completely random, that change the RNA that then could potentially change, for example, a protein on the surface. And for SARS-CoV-2, the virus that causes COVID-19, could change the spike protein. And that is what we call a mutation. So it's really a mistake. And if it's advantageous for the virus will keep it, and all of its babies will have that new mutation. So for the Delta variant, it does seem to be much more contagious and spread more easily because the spike protein has been altered in a way that makes it more contagious.
Right. So what can be done to reduce these mutations?
The answer is vaccinate, vaccinate, vaccinate. So when a virus gets inside your cells and begins replicating and making more of itself and changing and making more copies of its RNA, that's when these random mistakes, which we call mutations, can happen, and that's the only time it can happen. It doesn't happen outside of the cell or outside of a human body if it's a human virus like SARS-CoV-2. So if you're vaccinated and you're not infected, that then thereby reduces the number of people infected, so it reduces the number of chances to replicate, and the chance for a mutation or a random change is reduced. The other mitigating factors like social distancing and hand washing are certainly important, but the gold standard is vaccination. That will reduce the chances of mutations and probably stop it.
Well, thank you, Dr. Faircloth. Blazers, if you have any questions related to COVID-19, please email studenthealth@uab.edu. Until then.